Hi everyone, Dr. Jeff back with you this week. I've been away for a couple weeks. Hope you enjoyed Fiona's video. She's put a lot of effort into it and lots of things on low back and necks and exercises for people that spend too much time at their desk. So this week we got a good topic.
Talking about hip flexors.
And what are your hip flexors?
So there's three main ones. There's the iliacus, the psoas, and the pectineus.
So if you're looking at your spine here, the psoas muscle actually attaches the second, third, and fourth vertebrae here in the lumbar spine. Kind of goes down, and you've got your femur kind of attaching down in here, and it runs down and attaches to around the greater trochanter of the femur. The iliacus actually is kind of forms on the ilium here and goes down, attached to the same spot. These muscles kind of merge themselves together and kind of form one big muscle. Pectineus is kind of a little more in your hip here and your pelvis. They're very important pelvic floor stabilizers, very important posture stabilizers. I like to say these muscles are responsible for bringing your knee to your chest, so coming up this way here, and also your chest down to your knee. That's kind of what hip flexors do.
Yeah. So why do tight hip flexors, why is an issue? So since your hip flexors attach to your pelvis and also your lumbar spine, it could bring your pelvis forward, tilt it forward and also down, and then cause hyperlordosis of your lower back. That puts undue pressure on your discs.
Yeah, the discs are designed in a certain way to have the pressure kind of going through them in a certain spot through the nucleus. And what can happen is if your curvature in your spine is a little bit too great, what happens is the pressure is going to start to go down a little bit posterior to where it's supposed to, so it's going to miss the nucleus. And likewise, if your spine is too straight, it's going to start to go down the front of it. And if the pressure isn't going through the right part of the disc is going to break down sooner. You're going to get early signs of degeneration of the disc and some issues with your back.
Okay, and what causes these tight hip flexors?
Well, the number one cause is prolonged sitting. So if you're sitting at a desk or sitting on a plane like I was for 16.5 hours, if you're sitting too long, your hip flexors stay in a contracted state like this, and they get comfortable being there, and they don't really want to stretch anymore. And they are postural muscles, and they can also fatigue if they stay in one position too long. So number one cause is sitting too long, and these are usually the people that will get up and they can't quite get up like that, and they have to kind of straighten out. Number two, again, is when I was hiking, is climbing stairs or climbing mountains, or people like to hill run, things like that. That's kind of the number two cause of psoas hypertonicity. But the one thing with your psoas is because your psoas is a very important postural muscle and a very important stabilizer of your pelvic floor. People that get back pain generally will always find that their hip flexors, their psoas and iliacus, are also very tight. And we also find again that people that have tight psoas and iliacus, because it's pulling that spine forward, are going to be more prone to having back pain.
And some of the symptoms of tight hip flexors is groin pain, lower back pain, and like Dr. Jeff said, difficulty standing up.
Mm-hmm. So a good way of testing this, all right, I'll get Fiona to lie down for me. It's a pretty simple test. We get Fiona to bring her knee up to her chest. And I can't bring my knee that far. What we're looking for is this knee to actually lift off the table a little bit. That's telling me that we've got a very tight hip flexor there. So we want to keep that flat on the floor. So something you kind of test at home and see if you've got a tight hip flexor. You want to test for strength, because quite often, again, a tight muscle is also a weak muscle. So another way of testing is for strength. So we just get Fiona to hold her leg up like this. And again, as I mentioned, it brings your chest to your knee or your knee to your chest. So we're going to hold it here. I'm going to push down on it, and should be able to hold it up against my resistance. Return the toe out here, test the iliacus again, we can push down there. If for some reason her hip flexor was weak or really tight, I'd be able to push it right down to the ground. So those are a couple tests you can do to try and test for your hip flexor.
So how do you deal with those tight hip flexors? Well, you can stretch them. So I can show you here. So the first one is kind of like a lunge. So I'll just kind of lunge forward in this position, and it'll help stretch the hip flexors here. The next one is kind of like a sitting hip extension. So I'll just sit like that and then lean forward.
Yeah, you go a long ways.
And then the last one I'll show you, but at the table here. this, oops, and then just go up and down.
Cool.
Yeah.
One simple one I recommend to all my patients is is when you go to bed at night is just take that leg on the outside of the bed and just drop it off the side of the bed and let it hang there for a bit. If somebody's around, they can kind of push on it to stretch it out a little more. Or if you're lying on the couch, you can drop the leg off the side of the couch. You can let it hang there. And just like gravity, kind of stretch it out. It's a pretty simple one. You can do at home that just kind of stretches your soles so you even try to do anything.
Yeah. Thanks for watching. If you enjoyed this video, please give it a like and subscribe. Share with your friends and family, and comment down below if you have any future video ideas. And as we say at Gold Wellness,
we got your back.